Hi, my name is Donna DeGrazia, Donna Sidwell DeGrazia. I have been a physician assistant for over 40 years and a medical educator for over 20 years. I'm also a two-time breast cancer survivor. When I was first diagnosed, I realized that despite my years of experience, I did not know much about breast cancer and the patient experience. I had entered a whole new world. Soon, friends were coming to me as they were diagnosed with breast cancer as well. They all had questions about what to expect. None of us knew what to expect. My experience with breast cancer and the questions asked by my friends prompted a series of interviews with survivors, their loved ones, and medical providers to learn more. The interviews led to a book, and the book led to a series of podcasts that I am doing to bring some of what I've learned to more survivors. Breast cancer is very common. 1 in 8 women will be diagnosed with it at some point in their lives, and 1 in 10 breast cancer patients is a man. My 3 earliest childhood friends all had breast cancer. I'm the only one of us still living. That's why I decided to put together some basic podcasts on breast cancer. Knowledge is power. The more we know, the more we can do to stay healthy. This first short podcast is an introduction to breast cancer. What is it and how does it spread? I use flowers in this presentation, not to say that breast cancer is a beautiful thing. It's not. But as a way to make this less of a medical lecture and more something that we can all relate to. Besides, I don't have the equipment necessary to take pictures of tiny cells dividing and spreading or the artistic and technical skills to draw diagrams as I talk. Instead, I'm sharing my love of nature and photography to illustrate my points. Sometimes a picture is actually worth 1,000 words. In my book, Reconstructing Hope, I use poetry to bring home the personal impact of the disease. Okay, enough about me. Let's start to talk about cancer. So let's start with the difference between cancer cells and quote unquote normal cells. Normal cells have a distinct purpose. They live a certain amount of time to fulfill that purpose and then they die. They only divide and continue to grow for a predetermined amount of time. This is the natural cycle of life. Cancer cells are mutants. The turn-off switch is damaged. It doesn't work. Those cells just keep dividing and replicating over and over again. There was a woman named Henrietta Lacks who died in 1951 of cervical cancer. Some of her cancer cells were harvested by a researcher and have divided so many times that descendants of her cells are still being used for medical research today. That seems crazy that the cells of a woman who died 70 years ago are still growing and dividing. It's no wonder we are all afraid of cancer. We need to respect it. Scientists have been busy finding ways to kill cancer cells and keep them from replicating, but that is a topic for another episode. As a way to make this less about medical literature again, I am using flowers. So now we'll talk about how cancer spreads. There are 3 basic ways. The rapidly dividing cancer cells can invade surrounding tissues. Just like in the picture, the flowers are coming through the fence. A tumor can keep growing and taking over whatever is next to it. Just like some flowers or weeds, they can gradually take over the whole garden. Cancer can also spread through lymph channels. Lymph nodes are small collection areas of lymph fluid that travels through the body as part of the immune system. When cancer invades the lymph system, the lymph channels can carry cancer cells from the site of origin, or the starting point for the cancer, to a distant part or distant parts of the body. Let's use the analogy of the bee carrying pollen or birds carrying seeds from one plant to another, helping flowers and other plants grow, sometimes in unexpected places. Cancer can also invade the circulatory system. This is a network of blood vessels that runs throughout the body. Not an exact analogy, but think of the dandelion blown into the wind by a small child. One pretty, fluffy little plant can infect an entire yard or even a neighborhood, turning green lawns into fields of yellow flowers, unwanted flowers. Cancer that spreads from its starting point to another part or parts of the body is said to have metastasized, or it can be called metastatic cancer. So, what are the symptoms? How do we know that cancer has spread? Cancer usually has very few symptoms early on. Symptoms related to metastases depends on where the cancer that was carried from the lymph system or the vascular system lands. For breast cancer, the most common sites of metastasis are lungs, liver, bones, and brain. Symptoms related to the lungs might be cough, difficulty breathing, or even coughing up blood. Liver symptoms might be bloating or jaundice or yellowing of the skin, nausea, or other related symptoms. Cancer that is spread to the bone can cause severe pain or unusual fractures, and cancer in the brain causes changes in consciousness, thinking, memory, and other changes. By the time these changes occur, the cancer is usually advanced and harder to treat. The first interview I did for my book was with a woman named Lisa, who discovered she had breast cancer with her shoulder pain that she initially thought was from tennis turned out to be metastatic breast cancer. When her shoulder pain did not improve with conservative treatment and rest, her doctor ordered an MRI that gave clues to the cause of the pain. Breast cancer can be difficult to treat because not all breast cancers are the same. It's actually a collection of diseases clumped together because of their common location. Think of a flower garden or bouquet made up of a variety of different flowers. Breast cancer subgroups are divided by characteristics such as tumor types, size, lymph nodes, involvements, spread, and sensitivity to hormones or other factors that help determine the best treatment plan. So I hope you've enjoyed this little introduction. There will be more to come. The next in the series will be related to prevention of breast cancer and screening. So thank you again for listening.